we're gonna show the way to fabricate what I call a semi-direct restoration. In this case, we're gonna be using a resin by Care, the 0.4 resin. And this is our initial view. This molar has a big destruction, especially in the distal area. As we can see from this x-ray, it needed a root canal treatment. And this is a very, very good indication for this type of restoration. So we will proceed to isolate the area using a rubber dam. And what I call the first initial prep will be to remove the old restoration and evaluate what's in the inside. We can start removing all that debris and that caries. And then using some caries detector, we will like to recheck and double check that there's no caries underneath. So we will proceed and do this checking and removing all the caries with a round burr. Once we are satisfied with what we got, we will proceed using Care's phosphoric acid. That's a 37.5% phosphoric acid. We will acid etch enamel first for 10 seconds and then the inside, the dentin area, for another 10 seconds. Proceed to wash the acid and then air dry for no more than 5 seconds. Then we will go ahead and use Optibond Solo Plus. That's an adhesive, and the best way to apply this adhesive is using a micro sponge. We will work the adhesive. We will really have to work it out and burnish the adhesive into the dentin and the enamel for 20 seconds and then air thin it. Finally go with the Optilux 501 light and polymerize it for 20 seconds. Then we will take some flow material like the Revolution 2 or 0.4 flow by Care, and then we will apply a layer and trying to cover all the irregularities and try to really seal all the denting with this flow material, and again polymerize it for 20 seconds, and this is what we will get. Then we will proceed and finish our prep, rounding everything, remove the rubber dam, place some retraction cord, and take an impression using a material that needs to be a silicone reaction type of silicone, because the material that we're going to use to pour this impression, it's a silicone type of material but with a different type of polymerization. This is a vinyl polysiloxane. It's the Parkel Match 2, and then using 0.4 as the restorative material, we will proceed to fabricate the restoration. This while the patient waits for us. This is the different colors that we're going to be using. So here we see our impression already poured. This is the dye that we're going to use. It's a silicone dye. It's a very hard silicone, but very easily maneuverable. So we'll start putting a small amount of the enamel resin on the margin, polymerize it for 10 seconds. Then we will finish the distal area using also enamel, polymerizing for 20 seconds. Then we will go and start building the inside, first in the box using dentin. Then we will proceed and start doing some anatomy, put some more of the enamel on top of it, and then we can use some of the Color Plus material to stain and put some white, some yellow, some dark stains, whatever we want, in order to make it look more natural. Once that is completely set, we will polish the margins and set and retouch our anatomy, and this is what we get. Then we will cut the die in order to gain access to the margin, set our restoration, and we can see that there are some defects on the margin. We can go ahead and seal those defects with some enamel, polymerize it, and then we're ready to polish using some rubber points and some brushes. We will polish the restoration. And before getting back to the mouth, we have to bring the restoration into a plastic bag, seal the plastic bag, and put it in boiling water for 10 minutes. That will help us increase the strength of the restoration with that thermic bath. Then we will remove the restoration from the plastic bag, clean it up, and this is what we get. Go back to the mouth, isolate the area again with rubber dam, check the restoration, how the contact area, the margins, be sure that the restoration sit completely. Then we will clean the inside of our restoration using phosphoric acid for 20 seconds, wash it and dry it, and then we will apply one layer of the Optibond Solo Plus without polymerizing it. Going back to our preparation, we will clean it with pumice, wash and dry, and then we will proceed to do the etching for 20 seconds, air thin it, wash and dry, and then we will apply a layer for 20 seconds of the Optibond Solo Plus, again without polymerizing it. The reason we would not like to polymerize this is because we are going to use as a cementing medium the same resin, the 0.4 resin that we use to build the restoration. This in order to avoid any cement margin on our restoration. The only condition to do this procedure is that the thickness of our restoration is no more than 2 millimeters in order to be sure that our light will go through and polymerize that resin underneath. We can very easily adapt our 0.4 material into the margins, into the inside, place the restoration, and we have all the working time that we need because this is not going to set until we apply the light. So very easily we can set, remove the excess of the material, be sure it's completely all the way into position, and once we are ready, then we can go ahead and polymerize, giving it 10 seconds from the buccal, 10 seconds from the occlusal, and 10 seconds from the lingual area in order to set our material. Then we can proceed to finish our margins using a diamond burr. We can clean the margins, we can smooth, and then with some brushes we can clean completely and be able to smooth the margins. This is the way our restoration should look. As we can see, there's no margin that showed through our restoration. Then we will go ahead and acid etch all the margins using phosphoric acid for 20 seconds, wash and dry, and then we will seal the margins with the OptiGuard by Care. This is a solvent sealant. Using a micro sponge, we will work our sealant on the margins for 20 seconds, air thin it, and then do our final polymerization, 30 seconds from the buccal, 30 seconds from the occlusal, and 30 seconds from the lingual. And this is our final restoration. Remove the rubber dam, check the occlusion, do whatever adjustments need to be done, and polish those like we're doing here. That's our final restoration. An X-ray showing the adjustment in the margin, in the distal margin. And this is 1 month post-op. Very, very good margins, very good adaptation.